let's put the things together for the preparation. So one idea, and I like the textbook of Luigi Testori on the sinus floor elevation, is to start with a small window. And if you look at these drawings, they are brought from one textbook to another. This is a drawing where I find at least 5 mistakes. Look, the incision line is far too close to the window. I would never do such a large window again. This was a drawing from the 1980s and it's brought from one textbook to another. I like much more this drawing where you see there's a tiny little hole to the bone. Then you do the preparation, and it's very important to reach the opposite part of the bony wall. So often this is not enough, the preparation there, because regeneration will start from this area. We use the piezo, the burr, or the scraper. Usually I start with the scraper. If I have any problems, then I switch to the burr or the piezo, depending of the availability. The soft tissue preparation usually is done manually, as you saw it in the pictures. So let's start with the question everybody thinks about when we talk about the sinus floor elevation. What is the minimal bone height I need to have when I do dental implants? You see, this is rather little bone. We have about 1 to 2 millimeters, and immediate implantation has been performed with the sinus floor elevation procedure. Here it's quite safe, I think. With a fixed provisional, it's a good situation to have. But we did a clinical study together with our colleague Knut Grötz from Wiesbaden, sinus floor elevation. And what he did is every patient who came in got his sinus floor elevation, alloplastic material, and immediate implantation in a single-stage procedure, regardless of the local bone height. So it was a retrospective study. We now have the 5-year follow-up of this study, and external sinus floor elevation. We use an alloplastic, not an allogenic, alloplastic bone substitute.